There are just over 16,000 kids in foster care in Ohio. Around 180 of them are between 19 and 21 and will soon leave the system since in 2016, the state raised the foster care age from 18 to 21. But those who age out face huge challenges as they begin living as adults because many don't have the education, stability, and support that other young people who've grown up in more traditional homes do. A 25-member task force has been traveling the state to hear testimony from child welfare advocates, foster parents, and kids who've been in the system to come up with ways to improve it. And they're recommending more pay for workers, more cooperation among agencies, more training, and more recruitment of foster families. And State House correspondent Joe Ingles reports they're also looking at ways to help those kids who spend their entire childhoods and teenage years in foster care.
When children age out of the foster care system, they face a lot of challenges.
We know these kids who age out of the foster care system are going to have a really hard time, especially that first decade after they're no longer foster kids. We know that almost half of them aren't going to complete their GEDs. We know that they are more likely to be on public assistance, more likely to have kids and be in the child welfare system again as adults. We know they're going to be challenged. We know they're more likely to be victims of crime.
The director of the Office of Child Welfare Transformation says the system is dealing with huge challenges, too.
The outcomes aren't great for our kids that are in the foster care system. We know that not just in Ohio, but nationally. We do know that kids do better in family-based settings, and we have a lot of kids in congregate care settings. And in some cases, they have very high-level needs and behaviors that may require some type of residential-type treatment. But we also know that should be used more for the most extreme circumstances. That should be short-term crisis stabilization with a plan to get them right back in some kind of family setting. And unfortunately, that's not what ends up happening. Kids are going to congregate care settings unnecessarily because we don't have enough foster homes for kids, or they're going there, they're stabilized, they're ready to move back to a family-based setting, and we don't have the capacity.
People who have aged out of Ohio's foster care system made their voices known at hearings held around the state during the past couple of months. In Cleveland, Natasha Davis testified she willed herself to not end up incarcerated like her brother or living in a world of drug abuse like her sister.
I am not a product of my circumstances because I told myself I didn't want to become another statistic. I would rather help improve them. I was placed in my own apartment at 16 because of the independent living program was available at the time. I graduated a year early and worked and saved every dime I made so that I could have enough money for a security deposit for when I aged out. Since then, I have received my associate's degree at Tri-C and transferred to Cleveland State University, where I will have my bachelor's in social work in just a few months.
Finding job training and educational opportunities can be difficult for some who age out of the system. But the way it stands now, some young people see college as the only viable option.
Kids went to college not because they wanted to go to college, not because that was their priority, but because they needed a place to live, because we weren't able to get them permanency or a family to call their own before they aged out of the system.
And even then, they face obstacles unique to their situation, things like getting colleges to allow them to live in dorms.
They want somebody else to sign in case there's any damage done to the dorm room. So even though he has the money, even though he has the resources, you can't just go in as an 18-year-old with no credit, no history, no background and be able to sign, the documents that you need to be able to sign.
Former foster care kids say Ohio's system needs to provide more guidance and support for young adults.
Giving a teenager guidance, even though they are too old to be adopted or been emancipated, still help them with learning what to do out here in this world. Because like I said, I'm living day by day, learning from my mistakes.
The Bridges program is designed to do that. So far, 1,250 young adults who have transitioned from foster care to adulthood have used it, and the state plans to expand the program. One former foster kid who was part of the advisory council hosting these forums says one thing is clear. The system needs to be more focused on the individual needs of each child.
You know, when you think of children's services, it's almost like running a business because they are providing a service. And I feel that sometimes, because we can be very process-oriented, we can forget about who we are serving. And I think that's where it feels like just a little dehumanizing.
Governor Mike DeWine says he wants the process to be more focused on the needs of individual children and wants more early intervention for kids in the system. These are a couple of the issues that are expected to be addressed in the final recommendations on how to improve the foster care system. The report is expected to come out this summer. Jo Ingles, State House News Bureau.